let's start off here, where Nehawu is vowing to forge ahead with protest action until its demands are met. Now, remind you what the demands actually are. The union wants a 10% wage hike, but the government is offering less than half of that, to be exact, 4.7%. The strike has sadly gone down into scenes of intimidation and violence. So let's find out where we are today and what does the week ahead look like. Reporter Manqoba Mchunu with us, talking about a briefing that had taken place, and let's find out where we are with this as well, because it's been a week that many patients have been turned away. Manqoba, we've had scuffles with police. We've had health sectors being badly affected. We can't go into another week of this. So where are we this Sunday afternoon?
Well, Gareth, unfortunately, the union saying that they're going to intensify their protest, and by that they mean that they're going to ensure that, from where we stand now, more services are going to be disrupted. And of course, the union saying that it cannot divulge how exactly it plans to intensify the strike. But given what we saw last week, where patients were turned away at some of the facilities, we also saw acts of violence and intimidation. Surely we can expect that there will be disruptions to more services at facilities across the country. Of course, we know that Nehawu represents the bigger chunk of healthcare workers, and so if the union says they're going to intensify their protests, this means that a lot of services will again be affected in the coming week. Of course, there have been those unfortunate incidents that are reported of intimidation and violence. The union saying that it's not condemning any violence, but of course it says that it's the employer that has been arrogant as far as this impasse is concerned to, come to the table and to, accede to some of their demands. Of course, they are demanding a 10% wage increase. The government is offering 4.7% wage increase, but they're saying that this is not exactly what government is offering. If you look at what is on the table, this equates to 0.5% increase, given that that non-pensionable gratuity that they had been given. Government has, included that as part of this deal, which will fall away when they start the new wage negotiations for this year and next year. They're saying that they also don't want to continue with the negotiations if the issues of the previous, wage agreements or negotiations that they were having are not resolved. You recall, of course, that last year government implemented a unilateral 3% wage increase, which all the unions in the public sector were not happy about. So they're saying that they want that issue to be concluded first before they start with the negotiations of 2024. And of course, they're saying that if government fails to do this, then they're going to intensify their protest. And of course, we know that other unions have also indicated that they are joining the strike, and this includes the police union, POPCRU, as well as the Health and Allied Trade Indaba union, which represents about 20,000 odd of those healthcare workers. So we're expecting to see a lot more disruptions in the coming week because of the intensifying of the strike.
And I suppose the issue that many people will be thinking about this afternoon is the court interdicts which have come into place. And I think you may need to just set the context for the courts for us and which parts of the strike in which part of the country have been interdicted. Because I know it was the Western Cape Health Department got an interdict against disruptions for the provincial health department, but that's just one province. What does it look like around the rest of the country?
Well, according to Nehawu, they did mention, Gareth, that in fact it is now 8 provincial departments, health departments that have been able to get these court interdicts. These are the interdicts against the violence and intimidation that's occurring. That will see, of course, police also, playing an active role as far as the barricading of the streets and the gates at these hospitals. We understand that the only province that has not sought an interdict at this point is the Northwest Province. And this is according to the union. But we know this is, of course, not the only legal challenge that they're facing as far as the strike is concerned. The Department of Public Services and Administration has also gone to court to interdict the strike. And this was last week, Saturday, and they were granted that interdict. But Nehawu appealed that interdict, which meant that then on the 6th, which was last week, Monday, they then went on with the strike. But again, government went back to court on that same day, and they actually requested for an execution of that earlier interdict so that the strike does not continue. Nehawu again appealed that particular interdict. So it's been a back and forth legally between government and Nehawu. You recall, of course, Gareth, that on Friday that hearing was heard at the Labour Appeals Court, and the judgment on that is expected tomorrow. And of course, that will decide whether or not the strike is legal, firstly, and whether or not the workers can continue with their protest. Of course, the union insisting that they won't stop up until those demands are met, and that they'll explore other legal avenues, if needs be, to ensure that the strike continues.
And despite all of that, while we're busy talking about the, like how you phrased it, the backwards and forwards, it's like a ping-pong contest right now between government and Nehawu. Let's not forget the real victims of what is going on here is the patients. Friday, we were reporting that patients were being evacuated from certain healthcare facilities, being moved elsewhere as well. Never mind people who've been arriving to receive chronic medication, those who need chemotherapy, very serious illnesses being turned away. They're being denied, essentially, their right to healthcare as well. What does Nehawu say about that?
Well, Gareth, Nehawu says this is unfortunate, but it says that, government should take the blame for that because they are the ones who are, not taking seriously the demands of the workers. In fact, they say that government is negotiating in bad faith, given that they haven't even concluded last year's wage negotiations, and they're now pressing ahead with these new wage negotiations. They say that they're not going to accept that as a union. Of course, you know, Gareth, that there have also been indications that 4 people have unfortunately lost their lives due to the strike. The health minister last week saying that this is as a direct result of this particular strike. But the union saying that, government should take blame for this because they're saying that, government has said that they're going to investigate this matter. They'll await that investigation, and they're saying that as a union, they don't believe that they're responsible for the deaths that happened. It's government that ultimately did not want to agree to them as far as, the number of workers that will be working at some of these facilities, the minimum service level agreement that was supposed to have been negotiated on. They're saying that government did not want to come to the table to negotiate this. So they're saying that they're not only to blame, but government should also look at itself as far as taking responsibility is concerned. Of course, the union saying that they're not going to be taking responsibility at this particular point for patients being turned back. This was one of the arguments that was also made in court by government, saying that they believe that, the union being on strike, first of all, we have essential workers who are meant to be on duty on strike, and these essential workers are breaching the law by being on strike, but also that they could not, continue with their mandate, constitutional mandate to provide healthcare services because of this particular strike. But Nehawu saying that it's actually government that's stopping all of this and really halting this process.
And I suppose the argument is going to keep going on in circles, and I imagine the issue of essential workers will become central to the court case argument as well. Just as I start saying goodbye to you, so it's a Sunday afternoon. Many people watching now might have loved ones, if not themselves, that are thinking tomorrow morning, i.e. Monday morning, they'll be able to go back to some healthcare facilities and get the help they needed. But you're saying there's this hearing tomorrow. So tomorrow morning, are we going to see more Nehawu action, or are they waiting for an outcome? Or can we expect more protests early tomorrow morning?
Well, Gareth, they're going to continue with their protest. They say, while waiting, of course, for that court judgment. What the court judgment will be at this stage, we do not know. But one of the arguments that was made in that particular challenge is the fact that, essential workers should not be part of this strike. And these are nurses and people that are needed that provide those healthcare facilities. Because when we covered it last week, Wednesday, at Charlotte Maxeke, patients were not even getting food because some of the workers, the non-essential workers, are also part of the strike. And what Nehawu is arguing is that they want those that are non-essential staff to continue with the strike. Of course, they do say that they understand that essential workers would perhaps need to go back to duty, but they're saying that the strike is going to continue indefinitely up until those demands are met. And of course, the union saying that they're going to continue regardless of what happens. If the court, however, does find that their application is dismissed, then they'll look at other legal avenues. Perhaps they'll look at another appeal at another court to try and challenge that. And while the appeal, of course, is going on, they're saying that the strike will also continue.
And that's what it looks like for tomorrow morning. Monday morning, I'm afraid it's going to be another week of what looks like disruptions at various healthcare facilities. My thanks to eNCA reporter Manqoba Mchunu on that for us as well. He knows the ins and outs of this as well. He's going to stay on top of that for the rest of the week. So if you know of someone, if not yourself, that needs to be going to a public healthcare facility, perhaps you might want to make sure that you are able to get the help you need tomorrow morning, because it looks like this Nehawu strike is still going to have a crippling effect as we go into a brand new week.